Hi, my name is Amy Lee, and I'm Program Director for the Consortium of Eastern Ohio Master of Public Health Program, and I'd like to share some information about the program with you. Let me share my screen. So, as you know, this is a consortium, meaning we have several partners. Our partners include the University of Akron, Cleveland State University, Youngstown State University, and my own institution, Northeast Ohio Medical University. So all of our university partners share resources. So we all contribute faculty. Cleveland State University provides their learning management system through Blackboard. We put all of the students into Blackboard so that faculty teach out of one course. And we also provide electives and also just wonderful people. All the students are admitted to each of the universities. So the Consortium of Eastern Ohio Master Public Health Program started in 1999. We are accredited by the Council on Education for Public Health. And I have to say, at our last site visit, we were all compliant with all of the criteria, a fact that I'm very proud of. We have 2 tracks and a couple of pathways through a couple of our universities. Most of the students go into the generalist track, which is flexible in terms of the electives according to your topic interests. Our students are very diverse. We have students who are fresh out of their bachelor's program and up to people who are retiring. We had a retiring biology professor, a retiring surgeon, and a physician who is well into her practicing years. But other backgrounds, as well as physicians, include nurses, public health professionals, administrators, researchers, people with backgrounds in nutrition, environmental sciences, educators, health and non-health fields. And we have alumni all over Ohio as well as the country. We have 5 health commissioners in Ohio who have graduated from our program. We also have epidemiologists, department directors, and physicians who have gotten promoted in the departments because they got their MPH degree. This is our mission statement. We want to prepare current and future professionals through accredited education, research, and service to improve the health of communities in Eastern Ohio and beyond. We do this through collaboration among the universities and our many agencies. And we do this in many ways in the program. So in several of our courses, we have community-based projects, and the instructors bring community agencies who have projects pertinent to the course topics, bring them directly into the classroom, and students work in teams. And at the end, they present their projects to that particular agency. And many times the agency representatives they use the product, or they may use it in small ways, or they may use it as ideas to springboard other ideas. And it's really been a great relationship between the students in our class and our agency partners. Faculty also team up. We plan assignments together. So we presented at a national conference our epidemiology outbreak exercise. Dr. Allensworth Davies is our epidemiology professor, and Dr. Margot Ermy is retired medical director from Summit County Public Health. And then I did the public information piece, and we discussed a case as an outbreak investigation, and we split students up into teams in the Zoom class. And so we work together as faculty and collaborate, and we also collaborate together in research and other projects. So at the bottom of the screen, the top row are some of the faculty members who are engaged in a grant that we received to put together a social media toolkits for our local health departments. And then on the bottom row were our student members. We had 2 MPH students and then a medical student who also contributed to this particular project. And we also included somebody who was tied to the CDC and also one of our alumni as well. Our program format is pretty much all online. We do have some Zoom sessions that we have, maybe 4 sessions out of 15 class dates in our courses. we also work a lot in teams. So students are put in teams to work on assignments, and when they meet when they want. And also we share networks among each other as well. So we're very collaborative, and we just all want to help each other fulfill our goal, and that is to improve the health of our communities. So how do we do this for all these courses? This is the schedule of courses, and this is just a sample schedule. You can finish the MPH program, which is 42 semester credit hours, the minimum it takes to be accredited. So you can take it anywhere from 1 year to 6 years. We do have some students who finish the program in 1 year because they're trying to get into a medical school or a dental school. And we have professionals who take 6 years. And some folks take courses one at a time. We often encourage the student to take 2 courses at a time. And if it's too much, you can always drop a course. But the 6 core courses that we have include public health concepts, which are offered in 2 semesters, biostatistics and public health, again, offered in 2 semesters. Social and behavioral sciences and public health and epidemiology are both offered in the spring. And then health services administration and policy and environmental sciences are both offered in the following fall. We have 3 generalist track courses, grant writing, offered in 2 semesters, public health practice and issues, which, by the way, is changing. We're going to be providing more leadership applied skills in this particular course. So applied health services administration concepts, and also policy and, well, actually more of the policy piece and advocacy. So more applied exercises in the public health practice issues course. That's just changing this year, actually. And then public health research and evaluation is applied biostatistics and epidemiology. So more in-depth doing research and evaluation. Then also required are our culminating courses, Capstone Project 1 and Capstone Project 2. Capstone Project 1 and 2 are offered all semesters, and that way, anytime you want to finish the program off, you can, because we offer it even if we have 1 student in the course, because we want to make sure people can graduate when they want. But Capstone Project 1 is an assessment of competencies before you graduate. We want to see where you may be a little uncomfortable still in your competencies, and we want to see where your strengths are as well. But it's also planning your capstone project. And then Capstone Project 2 is once the curriculum committee has approved your capstone project that you've planned out of Capstone Project 1, Capstone Project 2 is the implementation of that capstone project. And we have students working in teams where we say, you are the project manager, you work with a community preceptor and a faculty preceptor and any expert consultants that you want to finish your project. And then there are 3 electives. And we usually try to tailor the electives to topics that are pertinent to what you want to do in your future. And finally, this is my contact information. I previously was a practicing OBGYN, and I'm actually boarded, though, in public health and general preventive medicine. I have my MPH and an MBA to get that business side of things, and then I also have a certification in medical quality and a certification in public health. This is my email address. I'm happy to answer any questions or email you any information that you would like. As I always say, our networks are your networks, because ultimately we do want to promote the health of our communities. So thank you so much for considering our MPH program. Please give me a call or email me.